the Washington State Coronavirus Response released a comprehensive safety checklist for safer gatherings during COVID in the upcoming holiday season. Today, we have Thurston County Health Officer Dr. Dimyana Abdelmalek to talk about what to take into consideration when organizing your holiday gathering this year. Hi, Dr. Abdelmalek. Thanks for joining us today. How are you doing?
I'm doing okay. It's a pleasure to be here.
Thanks for joining us again on the show. We're here to talk to you about what to do during the holiday season. The holidays approaching, and we need to be safe. Your department is recommending fewer, shorter, smaller, and safer. Now, are these guidelines for everyone or just people at risk?
So these are actually guidelines for everyone. Having fewer folks at gatherings, making sure that we follow all the proper precautions with hand washing and masking and distancing. Those are all ways that we can keep ourselves and each other safe.
Okay, so one of the checklist items requires reviewing a guest list, and Washington State recommends avoiding high-risk individuals. How do you determine which people are at high risk, and how do you accommodate them?
Yeah, so folks who are at high risk are people who are at high risk for severe complications if they were to contract COVID-19. These include older adults and people with medical conditions such as cancer, kidney disease, COPD, heart disease, immune compromise, obesity, sickle cell disease, pregnancy, and type 2 diabetes. If you're not sure if somebody is in that high risk group, you can ask them before you gather. I know that when I'm chatting with folks in the community, people who feel that they may be high risk are already doing a very good job of making sure that they take extra precautions to stay safe.
Now, you're also recommending less than 10 people for non-religious gatherings. But how do you accommodate everybody if you have a large family, if you're going to have Thanksgiving or a Christmas dinner together?
So some of that, and you'll probably hear me talk about this a lot during this interview, is really making use of our virtual options. So Zoom and FaceTime, we're really fortunate to live in an age where we can be with people, around the world, even if we can't physically be present with them in our homes. So that's really the best way to gather, as well as just remembering that 10-person limit is important, because the more people who are gathered in a place, the more likely it is that one of those people may have COVID-19 and people could be exposed. So keeping gatherings small and safe is really important.
Is it also your recommendation if you have when you have 10 people together to have face masks on the whole time?
Yes, so all of the precautions that we've been using since the beginning are still important, and especially important during the holiday season. So that includes wearing face masks and maintaining a distance of 6 feet or more when you're with people who are not part of your household. And that's in addition to, keeping, high touch surfaces clean within the home, making sure that there's proper ventilation if people choose to meet indoors. So windows open if at all possible, not meeting in closed, poorly ventilated areas. And of course, it's always better to meet outside than inside where weather permits, just for that reason.
Yeah, and then when you were talking about the virtual options, I guess an old-fashioned phone call also works, right? Have somebody
Yeah.
on speakerphone. But well, how about sharing food? Is it recommended for you to bring your own food to holiday gatherings and only eat the food you brought? Or is it okay? I know it's not really transmitted through food. What is your recommendation?
Right. So you're absolutely right. COVID-19 is not primarily transmissible through food. Really, the key thing here is to make sure that you wash your hands before eating and after eating, when people are preparing food, to clean and sanitize surfaces where food is being prepared. avoiding and being really careful as far as cross-contamination if you're using raw meat or raw eggs, and cooking meat to appropriate temperatures. This is just good safety advice regardless of the pandemic. And just making sure that you're washing your hands frequently during the preparation process. For an extra level of precaution, wear a mask when you're preparing food, especially food that's going to be shared by others.
And when you are eating, and should you wear a mask and try to put the food inside there and chew with the mask on? Is that, or is it okay just take it off, eat, put it back on?
So each thing that we do has a level of risk. So the most essential thing is that when you're eating, making sure that you're at least 6 feet apart from anyone that you don't share a household with. That's going to minimize the droplets that could potentially transmit COVID-19 to someone else. I have seen different people do different things. So some people do kind of take down the corner of their mask, eat a bite, and put it back on. That happens to be what I do. Other people will take their mask off and eat. And as long as you have that separation between yourself and others, that should be okay as well.
How about if you're at somebody's house and you're a guest at their house and you're using the restroom? What are the kind of protocols that you should have in place? You keep your mask on, make sure you wash your hands. Are there any other advice for that?
So we have some advice for folks using the restroom and some advice for folks that are hosting.
Okay.
Okay. So avoiding, so in terms of high touch surfaces, using a piece of toilet paper to between your hand and say the flush handle or a paper towel, or using a paper towel to open the door. Those are all things that you can do to reduce your risk, as well as washing your hands extremely thoroughly, as we all always do after using the bathroom. And if you've touched a high touch surface after washing your hands, and you have sanitizer in your pocket, you can sanitize your hands after the whole process is over and you've left the bathroom. In terms of folks who are hosting, making sure that there's enough soap for your guests, making sure that there's hand sanitizer that they can use, if possible, encouraging people not to form a line at the door, so keeping people nice and separate. 6 feet or more, as well as potentially having even, cleaning supplies so that folks can wipe down high touch surfaces after they leave or things that they touch.
So as the county health officer, what's your best recommendation in the safest way to celebrate with family and or loved ones that are in assisted living homes?
So virtual meetings are definitely a really good way to connect. We do have a high rate of COVID-19 transmission in our county, and to prevent outbreaks and to keep everyone safe, I'm really recommending, virtual offerings, as well as window visits, which are where loved ones can see each other through a closed window and talk to each other on the phone, and that's a good way to connect during this time.
How about gift giving? Is there any precautions we should have? Giving a gift to somebody or accepting a gift? Can gifts be infectious?
So gifts and contact with objects is not thought to be one of the major ways that COVID-19 spreads. Really, the key is really good hand hygiene. So after you open a gift, making sure that you clean your hands very well, either with hand sanitizer or washing for 20 seconds. Before you touch your face or your eyes or your mouth, or anything where you could potentially bring virus from a surface into your body. So that's really the critical thing to remember about gifts, is that as long as you keep good hand hygiene and avoid touching your face with unclean hands, it should be safe.
And I guess that's another thing that the mask helps you with, is it keeps you from touching your lips and your nose and stuff because you've got that on. And if you want to do it, I can't touch it. So another reason they're good. Well, I want to thank you for everything you do to keep us safe. Is there anything else you'd like to add before we let you go today?
So I did want to add that we are in unprecedented times, and this is a novel virus, and we're learning more and more every day about how we can keep ourselves and our community safe. While we learn more about um, the big picture, the small picture, and what each and every one of us needs to do has stayed remarkably stable throughout this pandemic. So wearing a mask when you're out in public, maintaining that 6 feet of physical distance with folks not in your household. You know, if you must gathering outdoors if at all possible, and making sure that ventilation is good indoors if that's where you're gathering, as well as limiting the number of people to 10 or less in your personal gatherings. Avoiding close contact is always hard at the holidays, so air hugs, thumbs up, lots of smiles, and if we all work together, I'm hoping that we can make things different for next year.
All right. Well, thanks for being on the show again, and we hope to have you back maybe after the holidays. Check in again, see what's next on the horizon. Thank you, Dr. Abdelmalek.
Thank you for having me. It's been a pleasure.
This holiday season, the safest thing to do is to meet virtually using video conferencing or phone calls. Keep gatherings to fewer than 10 people and wear masks when around those who are not in your household. Provide soap and hand sanitizer too. For more information on guidance during the holiday season, go to coronavirus.wa.gov. That's all we have for this episode of Stay Safe Thurston County. If you have any suggestions for something we should cover, send me an email, rkam@tcmedia.org. Stay updated with Thurston Community Media, and stay safe, Thurston County.